So we were going to get started back at 1:15, and according to my watch, we are at 1:15. And now that you've had lunch and a little time to decompress, we're going to get those brains going again with a little bit of a case study. So this case study is going to incorporate both a start of care assessment and a discharge assessment with select items. We are going to start by introducing the actual case study, giving you guys an opportunity to read it in depth and start your coding of the start of care. Then we're going to debrief that start of care assessment, and then we're going to introduce the discharge items. At that point, you will have some more opportunity to actually code the discharge part of the case study, and then Kathy's going to finish it up with debriefing that discharge assessment. So with that in mind, it's an ambitious task. We have 2 full hours to work on it, and I know we can do it. So I'm going to go ahead and let Kathy get started with the introduction.
There we go. Okay, and did we all remember to lay off on the carbs, right? So you can all stay awake? Okay, one of the other things that we are going to do is partway through the time period for working through the questions and doing the coding, we are going to make sure to check in with you so that if you do finish early, we can get a feel for the room, and if we are able to move along a little earlier, we certainly will. Okay, so the case study is going to give us an opportunity to actually put to use all the information that you've gained over the last 2 days. These are the abbreviations that you will see in the case study itself. Our objective now is to apply the knowledge that you've acquired over this 2-day period to code the clinical scenario in a patient study. In the start of care assessment items, you're going to be looking at and coding M1060 height and weight, GG100 prior functioning everyday activities, GG110 prior device use, GG130 self-care, and GG170 mobility. In the discharge assessment, you will be looking again at the discharge status for GG130 self-care, GG170 mobility, J1800 any falls since start of care or resumption of care, and J1900 the number of falls since start or resumption of care. So those will be your task to get those done. With that said, let me introduce you. Mrs. S. She's a 70-year-old woman. She was admitted to the acute care hospital on March 3rd, complaining of right thigh and hip pain following a fall. Upon hospital admission, she was noted to have a right proximal femoral fracture, a large ecchymosis on her right thigh, and her past medical history includes hypertension, congestive heart failure, and depression. Mrs. S. underwent surgery on March 4th for a total hip arthroplasty to repair her femoral fracture. Her postoperative status was stable. However, her progress with inpatient physical therapy was slow. Mrs. S. was discharged home on March the 8th with a referral to home care for nursing, occupational, and physical therapy services. To work on the case study, we are asking you to work together in groups at your table. Use the documents you have in your folder to code the select start of care outcome and assessment items, home health quality reporting program training case study pages 1 through 4. You should find that in your packet. And the training case study coding sheet should also be in your packet. Okay? It is officially 1:20, so we are planning to give you 35 to 40 minutes. Based on that, what we will do is we will check in with you in about 20 minutes to see if we have a majority that are nearly finished, so that if we can finish sooner, we will. I will leave this up on the screen so that you can follow the instructions.
Okie doke, guys. I'm going to bring us back together so we have time to debrief this. Remember, we're only looking at the start of care. I know, I hear, aw, you want more time with it, huh? So how did you find it? Did you see it being a little challenging, or you got this? I'm here, no, nah, right now. Now, don't have this quite yet. Well, I think that's one of the challenges with case studies is that it's really hard to put into words what we see, right? And what we do. It's really hard to do that. And I think even having said that, I understand that clinicians or you guys yourselves might actually look at this and say, oh, I really thought it was a 2, and oh, but they're saying it's a 3. And so we're going to do our best to kind of explain our rationale around that, understanding that if you are on the fence about things, yeah, clinical guidance, right? Or clinical judgment is what we're going to want to use when we're in the heat of the moment, right? When we're out there assessing those patients, and that's what you're going to want to impart upon your clinicians when you're teaching this stuff, is that when you're vacillating, thinking about it, apply the guidance, and after that, you're still questioning. It's like, well, best clinical judgment at that point, right? And then let it go. It's okay. It's okay. Okie doke. So there's a lot to get through. I'm going to hopefully get this done in 30 minutes or so. Just to review that we were looking at the start of care, height and weight, prior functioning, prior device use, self-care, and mobility. And we're going to start this, oh wait, is this going in the right direction? Oh yeah, okay, great. So we're going to start this with the height and weight. So with M1060 height and weight, what do we get for height and weight? That's the first question. And you'll see we got for height, we got 62 inches. And for weight, we got a dash, okay? So let's talk about the rationale. Mrs. S was able to have her height measured in bed. That measurement was 5 feet 2 inches, which equates to 62 inches. She was not able to stand on a scale to measure her weight at start of care, and there was no previous weight in the last 30 days captured by the home health agency. Therefore, there was no information to code this measure, and when there is no information available, the dash would be the best response. Okay. Now let's look at start of care, the start of care assessment, GG0100, prior functioning everyday activities. And remember, this item has the 4, so we'll just go through each of these answering as we go, okay? So the first one would be a 3, okay? And the rationale behind that was Mrs. S was independent with her self-care activities such as bathing, dressing, using the toilet, eating, prior to her hip fracture. Okay, and so for B, indoor mobility, ambulation, we got a 3, okay? And again, prior to her hip fracture, Mrs. S walked by herself on indoor surfaces using her rollator walker. And then for C, stairs, we got a 2. And Mrs. S required standby assistance from her son to climb the stairs to the second level of her home prior to her hip fracture. And then for that final sub-assessment or sub-item, which is D, functional cognition, we got a 2. And Mrs. S needed some assistance with grocery shopping, paying her bills, and medication management from her son prior to her hip fracture. How'd we do on that one? Good? Okay, excellent, excellent, good. Okay, so let's look at GG0110, prior device use. And on this one, we're looking at, again, just checking all that apply. So the answer would be A, manual wheelchair, and D, walker. And the rationale is that Mrs. S used both a rollator walker, which would be considered in the walker. Remember, we think about all different types of walkers, right? And a manual wheelchair prior to her hip fracture. Okay. Now let's get into something a little more fun, huh? GG0130, right? Now we're going to really be challenging you a little bit here. So again, this is what the assessment item looks like at start of care. We would be coding both the start of care performance and your discharge goal. So I'm going to kind of go through both as we do. So we're going to start with A, eating. So for start of care performance, we got 0.5, and for the discharge goal, we got 0.6. And the rationale is that Mrs. S could feed herself but needed setup assistance from her son Mark once the plate was placed in front of her. Okay, the plate's been placed in front of her. Mark seasons and cuts her food into small pieces, and he also prepares her tea by adding sweetener and milk. Okay, so that shows that setup level of assistance that was needed for that activity. And your discharge goal would be independent, as it is anticipated Mrs. S will be able to set up her own meals and eat without any assistance by discharge. Okay. So our next item we're going to look at is B, oral hygiene. And those answers, 0.5 and 0.6. So your start of care performance coding of 0.5 is because Mrs. S could brush her teeth without assistance after Mark brought her a tray containing her oral hygiene items. Mark puts away these items after she brushed her teeth. Okay, so that's that setup again, right? And the discharge goal of being independent, as it's anticipated that Mrs. S will not need any assistance with her oral hygiene by discharge. Okay, so now we'll move on to toileting hygiene. And those answers are 0.3 and 0.6, okay, or 0.3 and 0.6. So 0.3 performance, this is partial moderate assistance. Mrs. S required trunk support from the registered nurse as she performed her perineal hygiene. Then the RN provided standby assistance as she adjusted her underwear and slacks, okay? So she did require some trunk support. We identified that in there. And then the discharge goal, really, again, going to that level of independence, as that it's anticipated that Mrs. S will manage her perineal hygiene and clothing without any assistance by discharge. Okay, so now we'll move on to showering self. And that is 0.2 and 0.4. And the rationale, Mrs. S reported only being able to bathe her chest, arms, and anterior thighs, and Mark washed the remaining parts of her body and dried her, providing more than half of the effort to complete this activity. And then the discharge goal of 0.4, supervision or touching assistance, it's anticipated that Mrs. S will be able to bathe and dry herself completely with standby assistance from Mark. So you're going to want to capture that level of assistance that you're anticipating that that patient is going to need at the time of discharge. So now let's take a look at upper body dressing. And those answers are 0.5 and 0.6, okay? So for the start of care, we're gonna be coding it as 0.5 setup or cleanup assistance, as once her undergarments and blouse were brought to her, Mrs. S completed the activity including fastening the front closure and threading her arms through the sleeves and fastening the buttons. Okay, so again, once it was brought to her. And the discharge goal was independent, as it is anticipated that Mrs. S will be able to dress her upper body without assistance by discharge. Moving on to lower body dressing, those answers are 0.2 and 0.6. So for the start of care, resumption of care performance, we are coding her at a substantial maximal assistance. Due to the fatigue and balance issues, Mrs. S required Mark to provide significant help to dress her lower body. Did you guys get that in the scenario? It was pretty significant that he needed to help her with. You know, he contributed more than half the effort to complete that activity. And then again, that discharge goal being that it is anticipated that she's going to be independent, right? She's going to be able to dress her lower body without assistance by discharge. And then our final item on this measure is putting on and taking off footwear. And how do we do with that? 0.2 and 0.6? Okay, good. Yes, nice, nice. So again, we're looking at needing substantial maximal assistance, as Mrs. S required Mark to contribute more than half of the effort to put on her socks and shoes. And Mark placed the shoes in front of her and put on her socks, and Mrs. S slid her feet into her slip-on shoes. And again, we believe that at discharge that she's going to be independent with this activity, and she'll be able to put on and take off her socks and shoes without assistance. So how'd we do with GG0130? Good? Yeah? I'm seeing thumbs up. That's all good. Okay, excellent. Okay, I got to catch up with my slides here. So then we're going to move on to GG0170 mobility. How are we doing with time? Okay, yeah, we're doing good. This one is going to take a little bit more time, don't you think? Okay, so let's look at again, this is the first half of that assessment. And again, we'll be coding the start of care performance along with your discharge goal. Okay, and we'll start with A, roll left and right. We got 02 and 06. Okay, seeing some heads nodding, good. And again, that's substantial maximal assistance, as Mrs. S required an RN to position a pillow between her legs to prevent adduction of the affected extremity, and then to assist her to roll side to side in bed. And the RN provided most of the effort. Right, okay. And her discharge goal being 06 independent, as it is anticipated that Mrs. S will be independent with this activity by discharge. Okay, our next item here is B, sit to lying, okay. And how do we do with that one? Did we get 02 and 06? Okay. So again, substantial maximal assistance. Although Mrs. S provided some effort by using her right arm to lower herself to a supine position, the nurse did more than half of the effort by lifting Mrs. S's legs and supporting her trunk during the activity. So you can kind of envision like the effort it took to get her from a sitting to a lying position. There was a lot of effort there. And then that discharge goal is being 06 independent, as it is anticipated that Mrs. S will be independent with the bed mobility, including moving from a sitting to a lying position by discharge. Okay, and then our next item is C, lying to sitting on the side of bed. This one we're familiar with, right? We've had that one for a bit. So let's see how we did with that. And again, we got 02 and 04. Substantial maximal assistance for your start of care, resumption of care performance. And that's because Mrs. S could bring her left leg off the bed and assist with pushing up with her right arm. And she required assistance to bring her right leg off the side of the bed and needed to be fully supported by the nurse to come to a sitting position. And the nurse provided more than half of that effort. And then the discharge goal, I think this is pretty realistic, is that, you know, she needs that supervision or touching assistance, because it's anticipated that she'll be able to move from lying to sitting with that standby assistance at the time of discharge. Okay? Okay, our next one is sit to stand. And we got 02 and 06. And the coding for that, the 02, is because Mrs. S needed maximum assistance from her son, Mark, to move to a standing position. Mark supported Mrs. S's trunk and most of her weight as she moved to a standing position. Mark also provided standby assistance as Mrs. S steadied herself with the rollator walker. Again, can you visualize how that kind of happened there? And then the discharge goal, again, it is anticipated that Mrs. S will be able to move from sitting to standing independently with the use of the rollator walker. So she'll be able to stand. And then again, that rollator walker is just to steady her at the end. It's not part of the activity. Okay. Moving on to E, chair, bed to chair transfer. And we got 02 and 04 for that one. Do you guys have a lot of cross-outs going on at this point? Yeah. Like I said, this is not a matching activity, right? This is actually thinking and applying and thinking about how we're going to apply that guidance, right? So this is. I hope you see this as a valuable exercise. So let's look at the rationale behind that. So this is 02, substantial maximal assistance, as Mrs. S required maximum assistance to pivot transfer to a wheelchair, as observed by the nurse and validated by the physical therapist. Mrs. S also needed a helper to position the walker prior and during the transfer, providing verbal cues throughout. The helper provided more than half of the effort to complete the activity. And, one of the things that I think that makes these items challenging is really understanding what's included and excluded in the items. And I do invite you guys to go back to the guidance, go back to the GG presentation that Anne provided us earlier. She was really good to kind of talk a little bit about those exclusions and inclusions, knowing where does that activity start and where does that activity end. That's going to be essential to accurate coding. And for that discharge goal, we are anticipating her to get to a level of 04, supervision or touching assistance, as it is anticipated Mrs. S will be able to complete the chair, bed to chair transfer with standby assistance by discharge. Okay, so the next item would be toilet transfer, that's F. And we got 02 and 06. And then for this one, again, we're going to be looking at it as a substantial maximal assistance, as Mrs. S required the nurse to hold the weight of her trunk and lower her onto the bedside commode. After voiding, the nurse helped Mrs. S's trunk to assist her to a standing position, and the nurse provided more than half of the effort to complete the transfer on and off the bedside commode. So let's move on to 06 independent, the discharge goal of 06 independent, as it is anticipated that Mrs. S will be able to get on and off the bathroom toilet independently using a raised toilet seat. Okay, and then the final item in the first half of GG 0170 is car transfer. Okay. And we got 10 and 04. So this one's interesting because we did use one of the non-attempted, right? One of the non-attempted codes, but yet we still coded that discharge goal. And we really wanted to reflect this because I think this is kind of a little confusing for some people, like, well, they didn't attempt it, why would I even know what they do at discharge? I hope you were able to pick up on that in that case study. So we did say that it was not attempted due to environmental limitations because the activity was not assessed at start of care because the car was not available during the assessment time frame. So think about that guidance, think about that and how you could apply that to other situations and scenarios. Mark reported that the family car was in the shop for repairs, and sometimes that is the situation, it's just not available, right? And then for the discharge goal of 04, supervision or touching, it is anticipated that Mrs. S will be able to complete the car transfer with contact guard assistance and the use of the rollator walker by discharge. So that we do anticipate her to gain some of that functionality. Okay, so we're done with the first half of GG 0170. How are we doing? Just checking in. We're doing good. I don't see any more thumbs up. What? There we go. Okay, good. Thank you. Thank you. I always like checking in because I think these things can be really long and they're hard to get through sometimes. And I just want to make sure we're doing well with at least feeling like you're getting something out of this. Okay, so for the second half, we're going to start with, again, coding your starter care performance along with your discharge goal. We're going to start with walk 10 feet. So our answers for this one would be 03 and 06. So for the code of the starter care performance, we chose 03 partial moderate assistance, as Mrs. S walked 7 feet with the rollator walker and steadying assistance from Mark. She became fatigued and required Mark to provide partial assistance by holding her belt to complete the last 3 feet of the 10-foot walk. The use of the device to complete the activity should not affect the coding of an activity. And that's a really important concept to make sure your clinicians are capturing. But what did? It was that assistance from Mark. That's what informed the coding, right? And then the discharge goal of 0-6 independent, it is anticipated that Mrs. S will be able to independently walk 10 feet using the rollator walker by discharge. Okay. So let's look at J, walk 50 feet with 2 turns. That's once standing, that ability to walk 50 feet and make the 2 turns. So let's just take a look at that one. This is 88 and 04. This is another one where we use one of those not attempted codes. So let's take a look at that rationale. So we did code it as 88, not attempted due to medical conditions or safety concerns. And this activity was not performed at start of care due to the patient's fatigue and decreased endurance. And I think we tried to really illustrate that in that narrative. In the discharge goal, we wound up coding at 04, supervision or touching assistance, and that's based on her prior mobility status and motivation to improve. It is anticipated that Mrs. S will require contact guard assistance when walking 50 feet and making 2 turns using a rollator walker by discharge. Boy, that's a mouthful. But I think that also talks a little bit about, like, we have to look at the big picture here, thinking about all of those factors that could inform that discharge goal. And I think we tried to show that it was not just about like, oh, well, we just don't think. You know, we're looking at things like her mobility status. We're informing it with her motivation, understanding. Because we have those patients, right, that'll say, I'm not doing anything else. I'm going to sit right here, right? You know, you're like, oh gosh, she's never going to climb 12 stairs. So, you know, so you'll get those scenarios, you'll see those patients. So you just got to think about that, how that will influence that discharge goal. Okay. Moving on, walk 150 feet. And our coding is 09 and 09. Okay, let's think about why would it be that 09 and 09. And the rationale is that we are considering this not applicable because the activity was not attempted as Mrs. S was not walking 150 feet prior to her current injury. So again, that past medical history really does help inform us to some extent about how we're going to be doing coding, especially when we're using that not attempted code. Right? That's going to be really essential. And then for your discharge goal, again, we're saying not applicable as it's not expected that Mrs. S will perform this activity by discharge. Mrs. S was not walking more than 60 feet prior to her hip fracture, therefore the activity was really not applicable. So she wasn't doing it before. We don't expect that she's going to be doing it in the future. And that's how we got to the 09 coding. Okay, so for L, walking 10 feet on uneven surfaces. I think this one's always a little precarious, especially if you have those patients fresh out of the hospital with like this decreased endurance that we really tried to illustrate in this scenario. So again, we coded this as 88 and then 04. The rationale is that it was not attempted due to medical conditions or safety concerns, right? Because Mrs. S reported that she could not perform this activity prior to her hip fracture with standby assistance. However, due to the patient's fatigue and decreased endurance, this activity just was not attempted during the start of care assessment. So we didn't attempt it, but she could perform the activity prior to her hip fracture. So there's a chance that we could possibly get back to that level. And as a result, we are actually coding that discharge goal. Another example of where we used a non-attempted code, right, at the start of care performance, and now we're saying, well, just because you didn't attempt it doesn't mean we're not going to try to set a discharge goal. Because again, that kind of, I think it validates that need for therapy a little bit, right? Because we do expect them to get to that prior level of functioning, right? So for her, it's going to be 04 supervision or touching based on prior mobility status. It's anticipated that Mrs. S will require contact guard assistance when walking 10 feet on uneven surfaces using her rollator walker. Okay, so the next one is one-step curb, okay? that we're going to be looking at, and that coding would be 88 and 04. And again, the start of care, resumption of care performance coding of 88, not attempted due to medical conditions or safety concerns. It was not attempted at start of care assessment due to the patient's medical condition and safety concerns. But it is anticipated, that's the reason we coded as 04, that Mrs. S will require contact guard assistance to go up and down one step curb, right? So she's going to require a little bit of that contact guard, which would be 04 supervision or touching assistance. So moving on to 4 steps. Okay, so we skipped it, right? Because we had that instruction if you code the 1 step as you didn't perform it, you wouldn't expect to perform 4 steps. But we are coding a discharge goal here. So we skipped the activity as it wasn't attempted, and since Mrs. S was unable to go up and down 1 step due to her medical condition and safety concerns, the 4 steps obviously were not attempted. But again, we do anticipate that she will require contact guard assistance to go up and down 4 steps. So we think it's something that she will be able to do at discharge. And then 12 steps, and I think you guys are probably seeing a pattern here, right? Right, so again, we're gonna skip that start of care performance. Again, she can't do 1 steps. How in the world would she ever do 12 steps, right? So we skip that one, we move on to the discharge goal, because again, we believe that there is a chance that she's gonna be able to get to that level of assistance of supervision and touching, right? And then requiring that contact guard assistance to be able to negotiate that up and down those 12 steps, okay? So now we're going to wrap this last piece up. I think we're doing pretty good with time. The next one is picking up object. Okay, so let's see how we did with that. That was 88 and 05. And we skipped this because it wasn't attempted due to a medical, we coded as 88 because it was not attempted due to medical condition or safety concern, as picking up an object was not assessed during that start of care assessment due to some safety concerns. And I think you can see that, that hip fracture, maybe she wasn't, she's not going to be able to bend down and pick up anything, especially if she maybe didn't have some of the adaptive equipment to help her with that task. And then for your discharge goal of 05 setup or cleanup, it is anticipated that Mrs. S will complete this activity from a bending or stooping position after setup of adaptive equipment such as a reacher. So now we're going to bring in someone, get that reacher, show her how to use it, and the idea is that now she's only going to need setup assistance. And again, I think that really shows, again, a real scenario when you're looking at discharge performance. So the next is that one of those questions, does the patient use a wheelchair and or scooter? And this is a simple no or yes, okay? And we're gonna code that as 1, yes. As the patient uses a manual wheelchair for self-mobilization around her home during the start of care assessment. And then the GG0170R, wheel 50 feet with 2 turns. We coded as 02 and 06. And the 02, the substantial maximal assistance, is because once seated in her manual wheelchair, she could only propel herself 20 feet before requiring some assistance to complete a turn. And Mark then wheeled her the remaining 30 feet to complete the activity. But we are anticipating at discharge that she's going to be independent with this, that her endurance will improve, allowing her to wheel 50 feet in a manual wheelchair and make 2 turns without assistance. Moving on, we're going to RR1, indicate the type of wheelchair or scooter used. And that answer is 1, manual. I think we talked about the fact that Mrs. S uses a manual wheelchair, so that's where that's going to be reflected. And then we get to GG0170S, which is wheel 150 feet. And that coding is 02 and 02. So we're seeing that she does require substantial maximal assistance because after propelling herself 20 feet, Mrs. S became fatigued and Mark propelled her the remaining distance. Mark contributed more than half of the effort to complete the activity. And we anticipate that Mrs. S will return to her prior level of functioning. We talked about that before, self-propelling approximately 70 feet. And she will require a helper to propel her further distances, such as 150 feet. And then I think, again, when we're looking at SS1, we want to know what type of wheelchair or scooter is being used. And in that one, we, again, are talking about a manual wheelchair. Okay, so I think that takes us to, and we talked about the manual wheelchair. So that takes us to the discharge assessment items. So we are going to have you guys review GG 0130 self-care, 170 mobility, and then the J 1800 and 1900 items, which is any falls since sock rock and the number of falls since sock rock. So again, we're going to ask that you work in groups and that you use the documents. This is page 5 and 6 of the case study, and then your case study coding sheet. And we will take a break. We're going to give you about 15 minutes or so to see how you do with that. And then we'll check back in with you guys to see how you're doing, and then we'll debrief afterwards.
All right, everyone. If we could come back together so that we can go through the discharge assessment items. How did you find the discharge assessment? Having gone through the start of care piece with Charlotte, did you find this piece any easier to do? Yes, good. Okay, so we're going to go through these, and I will go through each item and review the answers for you. We're starting with GG 0130, self-care. And we are coding the discharge performance here. And the correct answer here is 06A. Okay? She is independent. Mrs. S could set the table and prepare her own meals, and she could eat and drink without assistance. Moving on to oral hygiene, this was also a discharge performance coding of 06 independent. Mrs. S could now brush her teeth without assistance. Moving to item C, toileting hygiene. Again, on discharge, we code 06 independent. Mrs. S performed her personal perineal hygiene without assistance. E, showering and bathing. Again, Mrs. S is coded as 06 independent. She could independently bathe herself while seated on a shower chair. Item F, upper body dressing. We've coded this discharge performance as 06 independent. The reason being that at discharge, Mrs. S could dress her upper body without assistance. Item G, lower body dressing. Coded as 06 independent, on discharge, Mrs. S could now dress her lower body without assistance. Item H. I can't, come on, there we go. Putting on and taking off the footwear. On discharge, we've coded her as 06 independent because she could now put on and take off her socks and shoes, but with the use of adaptive equipment. Note that using adaptive equipment does not make her dependent. She's able to do this without assistance of another person. The adaptive device does not render her less independent. Let's move to the GG 0170 mobility. Here we're going to be looking at A through G to start with. So item A, we've now coded this as 06 independent. Mrs. S is now independent in rolling left and right and onto her back in the bed. Let's look at the next one, item B, sit to lying. Again, O6. Mrs. S is coded as O6 independent. She can now roll side to side and onto her back without any assistance. Item C, lying to sitting on the side of the bed, O6. We've coded her as O6 independent because at discharge, Mrs. S can move from a supine to a sitting position without any assistance. Looking at item D, sit to stand. We have coded her as O6 independent. Mrs. S can now stand from a sitting position without any assistance. Once standing, she used her rollator walker to steady herself. Again, the device does not render her dependent. I'm going to move this a little bit. There we go. We're now going to take a look at item E. Come on, move along. Going from chair or bed to chair's transfer. The discharge performance code here is again O6 independent. Mrs. S completed the chair bed to chair transfers independently, again with the use of her rollator walker. Moving to F, the toilet transfer, O6. Upon discharge, we've coded Mrs. S as O6 independent. At discharge, Mrs. S can now get on and off the bathroom toilet independently using a raised toilet seat. Item G, the car transfer. We've coded Mrs. S here as an O4. Why have we made her an O4? Supervision or touching assistance. Mrs. S could complete the car transfer with contact guard assistance and the use of her rollator walker. So in this case, she's an O4 because she required both the contact guard of a person and the use of the walker device. Let's keep moving. On item I, walking 10 feet, I is listed as O6. She's independent. Upon discharge, Mrs. S can walk 10 feet using the rollator walker without any assistance. Item J, walk 50 feet. We've coded this as an O4, supervision or touching assistance. Upon discharge, Mrs. S can now walk 50 feet and make 2 turns using the rollator walker and contact guard assistance. The use of the assistive device to complete the activity should not affect the coding of an activity. She was an O4 because she required supervision or touching assistance of a person, but not the use of the rollator walker does not affect the coding level. Moving to the next one, to walk 150 feet. We've coded this one as O9, not applicable. This activity was not attempted. Mrs. S was not walking 150 feet prior to her current injury. So if she couldn't do it before, we are not doing this one now because it would certainly not be safe. The next item, walking 10 feet on an uneven surface. We've coded this as O4, requiring supervision or touching assistance. Mrs. S could walk 10 feet on an uneven surface with contact guard assistance using her rollator walker. So again, it is if she were using the device alone, she would be independent. Requiring the assistance of a person for supervision or touching makes this an O4. Let's move to M. Oh, come on. It just keeps going here, doesn't it? Doesn't want to play nicely. All right. So we've got here the 1 step, the 4 steps, and the 12 steps. And each of these is listed as an 04. The 1 step with the curb, 4 and 12. This is listed as supervision or touching assistance. She did require a contact guard to complete 1 step, such as a curb, 4 steps, such as going into a home, and 1 flight of stairs, which is usually 12 stairs from 1st to 2nd floor. She did require supervision or touching assistance from another person to complete the activity. Let's continue on in the mobility section. Item P, picking up an object. We've coded this as 05, setup or cleanup assistance. Mrs. S could independently retrieve the object by bending from a standing position once the adaptive equipment was set up. So she did need setup or cleanup assistance, which is why she's now coded as an 05. The next one, wheeling 10 feet with 2 turns. Does the patient use the wheelchair and or scooter? Yes, she used a manual wheelchair. For the next one, we're going to look at the type of a wheelchair that she used. And it says here that she's independent, 50 feet with 2 turns, and we know that she uses the manual wheelchair. So she's doing this without any assistance. She did not require her son to come and begin pushing her at any point during that 50 feet or in the 2 turns. That requires actually quite a bit of effort. If you've ever tried it, to sit in a wheelchair and physically push all of your own weight is quite something. To the next question, wheel 150 feet. Oh, there we go. Indicate the type of wheelchair. We've talked about this. She does use the manual. Wheeling 150 feet is coded as an 02, a substantial or maximal assistance. Mrs. S could wheel herself 60 feet, which is nearly her prior level of function. A helper was needed to propel her manual wheelchair the remaining 90 feet. Therefore, the helper contributed more than half of the effort to complete this activity. And she uses the manual wheelchair, not an electric. That brings us to J1800. Any falls since start or resumption of care? Did Mrs. S have any falls since start or resumption of care, whichever is more recent? And here we are saying 1. Yes, I heard that from all over the room. Good job. Mrs. S reported sustaining a fall during the care episode when she attempted to climb the stairs without assistance. And we know from earlier coding that doing the stairs, she did require supervision and touch assistance. So how many falls did she have? She had the 1 fall, and she sustained a minor injury, defined as skin tear, abrasion, laceration, or superficial bruises. That's how it's been coded. 1900A, no injury. 1900B with an injury except major, and 1900C, major injury 0. She sustained a fall on March 26th that resulted in a bruise and an abrasion, and she had no other falls since her most recent start or resumption of care. As you said right in the beginning, doing the discharge was easier. And clearly, our friend Mrs. S did quite well during the course of her episode of care. She was able to regain the majority of her activity levels. Now that we've gotten this far, do you have any questions about doing the discharge assessment? Anything that you didn't understand or that you think you or your staff might have difficulty with going forward in the future? No. That's good. This whole section, the GG questions, the J questions, doing them at start of care, resumption, and at discharge, this is complicated. And you are going to want to spend additional time with your staff, giving them some focused TLC attention to make sure they really do understand and have a good comfort level with being able to make this assessment and to answer the questions. Okay? So if no one has any other questions for us about the start and the discharge assessments, I'm going to turn the microphone back over to Bridget.